Thank you. Well, to see if this works. My first slide sort of demonstrates my greatest hour of my clinical career. An hour on the couch with my ultimate role model. And I say she's my role model because Oprah truly has empowered women and her audience like no other. And women and her audience have respect for her and listen to her, sometimes to my chagrin, it's upsetting at times, over almost anyone else. Almost over anyone else, except their physicians, nurses, and I would say pharmacists. People do care about what you have to say. And they may hear something on Oprah, but guess what? Your word is ultimate gospel. So you're in an incredibly powerful position. But right now, I'd like you to shift gears. How many of you have ever been a patient or a caregiver for someone? All of us. So keep that hat on. And for the next 40 minutes, we're going to really be in the role of the patient, because that ultimately is what this is all about. I started being passionate about this issue back in the 1970s, after nursing school, although that did give me a great view. But it was really the work of Kaplan and Greenfield, who, in the early days of the medical outcome studies, when they looked at patients in the 1970s and found that the more involved, engaged patients were, the better the outcomes. I mean, they looked at hospitalizations, hemoglobin A1Cs, all the measures that they had in those days. But interestingly, we've been giving lip service since the 70s to this patient-centered care and have done very little until now. And in fact, I spent most of the day here, and I am so impressed. So I think I'm going to have to change my talk a little bit. Because as I speak to audiences, I tend to say we continue to give lip service. You're doing more than giving lip service. But let me read for you the words of Kaplan and Greenfield. This was in an article in the Annals of Internal Medicine in the 1970s. At the end of their discussion, they basically said, no amount of technically advanced care, and I would say technically advanced, including pharmacy care, can take the place of an informed and involved patient. So if we don't inform and involve our patients, it doesn't matter how many great drugs, programs, clinical pharmacy services we have. Patients need to be informed and involved. I already mentioned there's a very clear link between getting patients involved and outcomes. You've seen that. Let me tell you a few other words that kind of have always inspired me, and that's this old Chinese proverb that reminds us it's not just about educating patients. And to quote from this old Chinese proverb, and you've heard this, tell me and I will forget. Show me and I will remember. Well, that does something. But involve me, and I will understand. And it's understanding that leads your patients to action. So all the educational programs in the world and the brochures, et cetera, really aren't going to address the issue unless you involve patients. So what does involving a patient really look like? Well, first of all, I might remind you that there are over 126 medical schools. Most of them are in Pennsylvania, I'm embarrassed to say, and we don't have a great pharmacy program that collaborates with the medical schools, so after today we've got to get going on that. And there are as well countless schools of pharmacy. There's one in Philadelphia that teach pharmacists how to be pharmacists. But there is not one school that teaches patients how to be patients. And I would argue that is part of what it sounds like you're doing today. You really are the pioneers.